Dr. B was a brilliant combination of the spiritual and practical. When he wanted to develop a system to achieve the maximum productivity for the money, he actually went to Oak Brook, Illinois, and visited McDonald's Hamburger University because he too wanted to serve billions worldwide. Dr. B recruited the best eye surgeons he could find, starting with Dr. Nam, and always attracted those who were willing to work long hours for low pay out of love for humanity. They hired young women in rural villages whom they had trained as assistants. This cut down on the number of doctors they needed. And they made the surgery available to millions of people with an aravind innovation. In cataract surgery, surgeons remove the clouded natural eye lens obstructing the patient's vision and replace it with a clear artificial lens. This lens costs anywhere from $75 to $100. So they pioneered a technique where they could make a lens of comparable quality for $10. When you want to multiply the number of people you reach, just cut the cost of the key procedure by 90%. Even though Aravind serves so many patients at such a low cost, their patient outcomes are ranked among the best in the world. Every patient receives the exact same world-class medical care, but only 30% of them pay. The other 70% get free care that is subsidized by the paying patients. The only difference in service between the paying and the non-paying patients is the amenities they receive. If you can't pay anything, you get very simple but clean accommodations. If you want a private room with air conditioning, you pay for it, and the fee will help fund surgery for all others. Aravind also serves the millions who can't easily reach their hospitals by running more than 1,000 free eye camps each year, as shown in the video. These are places where villagers can have digital pictures of their eyes taken, emailed over long distance Wi-Fi networks for evaluation by Aravind doctors. Aravind's super efficient approach has brought it an average annual return on its equity of more than 75% and allowed them to pursue debt-free expansion of their hospitals. They're not only making a profit, their profits are financing their expansion. This is a brilliant example of creative capitalism. They've driven down the cost of a life-changing medical procedure to the point where it's widely available to millions of poor people, and the services are funded not by foundations and not by governments, but by the people who receive those services. The people at Aravind understand their obligation to spread these remarkable methods, so they share their discoveries and approaches with others. They have trained 231 hospitals in India and around the world in everything from financial management to procurement to showing how to train personnel to assist in surgery. Muhammad Yunus has asked them to work with 7 hospitals of his in Bangladesh. And they're sharing the wealth that came from the discovery of the low-cost lenses. Today, their lab exports 700,000 of them every day to more than 120 countries. Of course, all of this talk about Aravind's numbers might take the focus away from the impact they make on the lives they touch. Let me tell you about a young boy named Suresh, who at 5 years of age began stumbling over the furniture, couldn't see the blackboard, and soon couldn't play outside with other children because it was too dangerous. Suresh's parents took him to a doctor who found he had cataracts. He was referred to Aravind's Children's Eye Care Center. His mother, Lata, said, "We are village people and felt doomed when my eldest child could not see. With very little money and very little hope in our hearts, we traveled all the way to Madurai. All the time I was thinking, will these doctors ask for a lot of money to save my child's eyes? Will he be forced into blindness forever?" She thought her family was going to be poorer, either because her eldest son was blind or because they would have to pay so much to help him see. Neither one. The surgery was a success, and it was free. Suresh could see and play and learn in school like the other kids. Sometime later, Suresh's younger brother developed cataracts, and he also had successful surgery, also free. Wouldn't you like to be there just once when they removed the bandages so you could see the smile of a child who just got his sight back? In another instance, a 40-year-old husband and father living in a village near the Aravind Eye Center became blind in both eyes due to cataracts, and he began begging in the streets. He was referred to the eye care center, had surgery, and recovered his vision. He then went back to his village, got a job in farming, and began supporting his family. He was so grateful to the center that for the next 28 years, until he passed away in 2000, he served as what they called a motivator, volunteering his time to convince very anxious patients with cataracts to undergo the eye surgery. I could tell you more stories about this surgery and the impact it makes on people's lives. Perhaps it would be fitting to let you see it for yourselves. Imagine if one day school looked like this to you, and the next it looked like this. Or if walking down the street looked like this instead of this. Or if your children looked like this instead of this. The man whose idea made this possible for millions of people, Dr. V, passed away in 2006. He is succeeded by Dr. Nam. Dr. Nam has a goal for Aravind of performing 1 million cataract surgeries a year within the next 5 years, a nearly 4-fold increase from the staggering volume they already perform today. Helen Keller once said, "There is no better way to thank God for your sight than by giving a helping hand to someone in the dark." If Aravind keeps growing as they intend, there will be no one left in the dark. So, for their magical gift of restoring sight, and for the guidance and inspiration they give to people doing miraculous things, I am very proud to present the 2008 Gates Award for Global Health to Aravind and his chairman, Dr. Nam.
Thank you very much. I am very much honored, delighted, and privileged to stand before you to receive this prestigious International Bill Gates Award on behalf of our institution, Aravind Eye Care System in India.